for tuning in to the next segment of Magic Moments with the Medicare Professor. I'm Patricia Mitchell, owner of Mitchell's Advisor Group Insurance Consultants or Magic Insurance Agency. So this video talks about Section 7 in the Medicare and You Manual, Get Help Paying Your Health and Drug Costs. So if you need to pause this video and go and find your manual, we're going to tackle how to get help, who qualifies for help. And if you think you qualify for help, give us a call and we'll help you fill out those applications. A lot of people spend more money that they don't have to spend more money. And we just coined this slogan today. It saves to be informed. It saves to be informed. If you are not informed about your Medicare choices, you can pay more than you have to. So today's section is on Section 7, and you can follow along. It starts on page 87. And we're going to touch on some topics in Section 7. Getting extra help paying your Medicare drug costs. A lot of you who are Medicare eligible or near Medicare eligible, if you turn in 65 in the next year or two, you've probably been bombarded by mailers, flyers, and letters saying, call now, you may be eligible for extra help or help paying the Part B premium. So let's dive in. Getting help paying your Medicare drug and costs. If you have limited income and resources, you may qualify for help to pay for some health care and drug coverage costs. Now, those people who are sending you those flyers are not going to show you this information. They're going to get your information and try to sell you a plan. If you've already got Medicaid or extra help, then we don't have to fill this out for you. But extra help, if you're single, your yearly income is under $19,140. This amount may change for 2021. So these are last year's amounts. So these amounts may be different. But if your annual income, single person, is under $19,140 and other resources are less than $13,110, and these amounts, you can have a little bit more resources and income this year. Or married persons living together, less than $25,860 and less than $26,160. And again, these incomes and these yearly resources are not reflective of 2021. So you can make more money and have more resources and may still qualify, okay? And it tells you there, these amounts may change in 2021. You may qualify even if you have a higher income, like if you still work, if you live in Alaska, Hawaii, or have dependents living with you. Resources include, and this is important, so this is a highlighter because most people think, oh, I got too much and I don't qualify. But resources include money in a checking or savings account, stocks, bonds, mutual funds, and individual retirement accounts, IRAs. But resources don't include your home, your car, your household items, burial plot up to $1,500 for burial expenses per person, or life insurance policies. So let's dive into that really quick. So the house you live in, the car you drive. But if you've got two cars sitting in the driveway and you're the owner of both, then they may count the other one as a resource. If you have a home, but you have another piece of property with a home or without a home on it, something that you pay taxes on, that second home or that land can be counted as a resource, but they don't count the home you live in. So there are different kinds and different levels, as you'll learn as we go on, of help, okay? Now, extra help is through Social Security. If you qualify for extra help and join a Medicare drug plan or Medicare Advantage plan with drug coverage, you'll get help paying those drug costs and have no late enrollment penalty. So those people who waited too late to get a drug plan, if you went 63 or more days without drug coverage, this may be one way to get rid of that penalty. So you automatically qualify for extra help if you get full Medicaid coverage, or you get help from a state Medicaid program paying your Part B premiums, which is under the Medicare Savings Program, or you get Supplemental Security Income, SSI. Medicare will mail you a purple or lavender colored letter to let you know that you automatically qualify. So if we fill out that extra help form for you and you get help, you're going to get a purple or lavender colored letter that tells you if you qualify. If you don't have Medicare drug coverage, automatically, if you get extra help, they're going to choose one for you. Now, that doesn't mean you have to keep it. You can enroll in another drug plan or another Medicare Advantage plan that has drugs. And most people don't keep that one. They enroll in a full health plan, Part C, that comes with drugs. And different plans cover different drugs. And so that's so very important. You have to look at what's called the plan formulary to make sure that that plan covers your specific drugs. So every formulary, every plan is not the same. So now extra help, again, we apply through Social Security. And extra help is for your drugs. So enrolling in a Part C plan does not mean that you automatically get extra help. Enrolling in a Part D plan does not mean you automatically get extra help. Extra help is a program that you apply for through Social Security that's going to help you pay your drug costs in that drug plan or in that Medicare Advantage plan with drugs. Extra help, and we help you fill out those forms online. Most all of the Social Security office and the defects offices are closed. So everything is done online. And we have so many clients that don't have access to a computer or the internet, and they have flip phones with no internet. So as a service to our clients, since 2008, we have always utilized all the resources that we have access to help you get every kind of help that you need, including when we fill out Medicaid application, the food stamp is right there. You just check it. So we help you with that too at no additional cost. We don't charge any fees for our services because once you enroll in a plan with us, we become your broker. We become the person that you call if you need help. Now, we don't insult anyone's intelligence. You can always call that 800 number on your own for customer service, but we do help you if you need that help. So that's the advantage of having a broker. You have someone to speak on your behalf, okay? So now, the next one is Medicare Savings. So a lot of people got these notices in the mail. Call now. You may be eligible to get your $144 paid. So this is what they were referring to. Medicare Savings Program. So let's read through this because this is very important. If you have limited income and resources, you may be able to get help from your state to pay your Medicare costs if you meet certain conditions. But they don't tell you that part, if you meet certain conditions. So if your income is more than the allowable amount, you're not going to get this help. But when you call, oh, but we can help you enroll in this plan, right? But they're not able to help you with what they said they could, which was get rid of that Part B premium or extra help. So we don't give anybody false hope. We give you the help that you need. There are 4 kinds of Medicare Savings Programs. So there are many different kinds of Medicaid. The Medicare Savings Program is a form of Medicaid through the Department of Family and Children's Services for the elderly, disabled, blind, or deaf individuals. or those with ESRD or Lou Gehrig's. You can get Medicaid, right? If you qualify and meet these certain conditions. Now, the kind of Medicaid that I was telling you about my grandmother had, she had that nursing home Medicaid. And that's another type of Medicaid that has that Medicaid Recovery Act tagged to it, right? That says if your property is appraises over $25,000, then you have to sell it and give them what it's worth, or they put a lien on it. So that's that nursing home Medicaid. The other type of Medicaid is like women and children Medicaid or cancer Medicaid. They're different kinds. But the one we deal with mainly is what's called the Medicare Savings Program. So the first level of help is called QMB, Qualified Medicare Beneficiary. If you're eligible, the QMB program helps to pay for your Part A and Part B premiums. In addition, Medicare providers aren't allowed to bill you for services and items Medicare covers, including deductibles, coinsurance, and copayments. So if you get the QMB Medicaid, it will pay your Part B premium, $148.50 this year, your deductibles, that $198 or $1,400, coinsurances, and copays. If you get a bill for these charges, tell your provider or the debt collector that you're in the QMB program and you can't be charged for these. So, if you're enrolled in a Medicare Advantage plan, you should also contact the plan to ask them to stop the charges. So, when you get your new Medicaid card, you have to present that card and this card. This is what the Medicaid card looks like. Now, everyone who has this card may not be eligible for the SSI Medicaid or the QMB Medicaid. You may be eligible for those lower levels of Medicaid that we're going to go over in just a minute. But this is the card. So when you get this card, you're going to show this card and your Medicare Advantage card at the same time at your doctor's office, at the hospital, at the pharmacy. This card, if you get QMB and their QMB Plus or FDBE, you're going to show this card when you go to the doctor. This is what picks up those copays, coinsurance, and deductibles. And again, if you have this card, give us a call because we can help check to see at what level you are. Now, some of you may have this card and you may be eligible for the next two levels. Specified low-income Medicare beneficiary, or what's called SLMB program, helps to pay your Part B premium only. Look at that word, only. Part B premium only. You don't see in blue deductibles, coinsurance, or copays. So that $148.50, that's all the SLMB is going to cover. Now, qualifying individual or QI program. This is a grant that's on a first come, first served basis. If your income is higher, you may qualify for help to pay that Part B premium as well. And then QDWI, these are for disabled individuals who are still working. Now, let's go back. Let's talk about those income amounts. So QMB, your income has to be under $1,084. And we'll try to put this up on the screen for you. QMB, your income has to be under $1,084 a month. Now for the SLMB, your income has to be under $1,296 for SLMB. So you can make from $1,084 and above to $1,296, roughly $1,300, and qualify for partial. So SLMB, SLMB is called partial Medicaid. And qualifying individual, you can make up to $1,410 a month and qualify. And I'm giving you the individual amounts. The couple amounts are different. So call us to find out those exact amounts. Qualified disabled working individuals, they can make up to $4,000 a month. So if you qualify for QMB, SLMB, or QI program, you automatically qualify for extra help paying the Medicare drug coverage. Okay? So the extra help is through Social Security. The Medicare savings is through Medicaid. Medicaid is a joint federal and state program. This will be a test question. Make sure you take those quizzes at the end of these videos so that you can enter for a prize, okay? Medicaid is a joint federal and state program that helps pay health care costs if you have limited income and resources and meet other requirements. Some people qualify for both Medicare and Medicaid. So some of you may have partial Medicaid and qualify for partial Medicaid special needs Medicare Part C plans. Some of you may have full Medicaid and qualify for dual special needs plans. They take all of your costs away, and they give you astronomical amounts of dental coverage and eyeglass coverage and hearing aid coverage and over-the-counter coverage and transportation and the pendants, the help or fall and can't get up button, okay? So all those plans, if you have full Medicaid, are loaded with additional benefits if your income is below $1,084. So if you have questions, there are many different programs that will help you. But these programs do not have, some of these programs listed here, they don't have licensed brokers that are able to go over each plan individually. They'll just spread them out like a deck of cards and you just pick one. So the one you pick may not be the one that best fits your needs. So please call us to review your Medicare choices. Let us help you determine if you have Medicaid or extra help, or let us help you apply for those benefits through Social Security or the Department of Family and Children Services. Please stay tuned for more videos, and thank you for tuning in with this magic moment.